And we are back with Catherine CVA from AARP, Steve Edmonds from Alliance Insurance Services. We're taking your questions about Medicare open enrollment, ACA open enrollment, all of those things you can ask questions about. Catherine, this person says, when does Medicare start? I turned 65 in December on the 10th. Will my Medicare start December 1st or January 1st?
December 1st. It starts on the month of your birthday. Even if you're on the 30th, it starts on the month of your birthday.
Okay, so, and they can apply, of course, for Medicare before December.
He's already in the window to apply, and my recommendation would be that he go ahead and apply now and then start making those decisions about what his Part D plan is going to be, and what other supplemental insurance he might need or want.
Okay. Steve, this person says, my husband went on Social Security disability in December 2023. When is he automatically going to get on Medicare?
Typically, Social Security will probably let him know that. But what we generally see is if you're approved for Social Security disability, you're usually eligible for Medicare after 24 months of that approval date. So it's usually 2 years.
Okay, and is it automatic or is it something where you should check about that?
I would check on it, but I'm thinking that they would probably be notified as well.
Okay. Yeah. All right. Catherine, this person's asking, can you qualify for Medicare and Medicaid benefits?
You can, and you can qualify for them simultaneously, but remember, Medicaid is income-based. So you have to be in a situation where you can show them what your income is like in order to be approved for Medicaid. Medicare is a much lower window for getting people in.
Okay, and we do want to remind you that the number is down there at the bottom of your screen, 336-379-5775 to get your question answered. Steve, this person says, I currently have health care through the marketplace. I turned 65 in December. Do I contact Blue Cross Blue Shield to tell them to stop my current insurance, or will Medicare contact them? I don't want to be without insurance.
So neither. When you have an ACA plan, you're going to have to either contact the agent that sold you the plan and have him do it for you, or you will have to call healthcare.gov directly, and they're the ones that will cancel the plan, and then they let Blue Cross Blue Shield know. So you call healthcare.gov. That's who cancels the plan.
Healthcare.gov cancels the plan. And I'm guessing if they turn 65 in December, they can sign up right now for Medicare and they can start getting Medicare. They don't even have to go through the ACA enrollment again.
No, they don't. They can stop the ACA December 1st, and then they'll be on Medicare at that point. So they'll be done with ACA after that. So just get your Medicare enrolled, and you should be good to go. Yeah.
Okay. All right. This person's asking, can I give up my job insurance when I retire for Medicare Advantage?
If you're 65, yes. Yes, if you're 65. But if you're under 65, you cannot. You would probably lose your group health insurance, and you'd probably have to go with an ACA plan to bridge the gap between 60 and 65 or whatever the age is there.
All right, and so Catherine, you know, we get the question all the time, what's the big deal between, like, you know, Medicare Advantage plans and a supplement plan and just plain old Medicare?
So the difference is what is provided in the plan. With a lot of the Medicare Advantage plans, you are, well, with all of them, you are in a network where they coordinate all of your care. And they oftentimes will provide things that general Medicare does not provide, and things like dental insurance, eyeglasses, those types of things, gym memberships. So what you need to do is look at your circumstances and ask the question of would you be better served with traditional Medicare or a Medicare Advantage plan? And that's usually who are the doctors that are involved, what are the level of services, and how much do I need in terms of medication and those types of things, and are they covered by the plan that I'm choosing?
Right, because supplement or advantage plan, that's the same thing. So it's either a supplement or an advantage plan or regular Medicare, one or the other.
Exactly.
No?
Not really. No. So a supplement usually ties in with with original Medicare. They're together. So because Medicare's only covering, like Part B's only covering 80%, so the supplement's coming in behind that and covering the other 20%. So Medicare Advantage is a whole different animal because it's really a contract with the insurance carrier. The insurance carrier is doing all the work for Medicare. So it's its own unique animal in that you have to follow the rules and guidelines of that particular Medicare Advantage plan and its networks. So
Okay.
they're kind of different. Yeah.
Okay.
Yeah.
All right. We were able to clarify that. All right. We are going to take a quick break. If you got a question, we got one last segment coming up.